Is it a struggle? Yes, we have to realize our strengths and our weaknesses. Hi, and welcome back to Why Not? And I'm your host, Janice, helping others to reach their goals and providing excellent information for them to help discover those goals. Today we have our topic is palliative care versus hospice. I know it's not the most exciting topic or most upbeat, but this is something that now with the pandemic and people having a lot of the elderly population is growing in numbers, these are some things that we're going to have to possibly determine in life, how to take care of our elderly family or sick and dying family, palliative care or hospice care. So I have a great guest in the studio today. Her name is Jessica Lyles. She's with Transit Hospice. Her job, she's a regional hospice and palliative coordinator, and she's our guest, and she's going to talk to us about this topic. Welcome to the show, Jessica.
Hi, thank you for having me.
Thank you very much. I know it's not the most exciting or upbeat type topic, but this is something that's really, unfortunately, close to my heart recently. My husband's mother just got COVID, and the nursing care facility called us up and asked us about hospice. And we really didn't know anything about it. And I knew about you, so I wanted to talk to you about that. For one, what is even the difference between palliative care and hospice?
Well, first, I'd like to just say it is a very touchy subject. I think that the connotation when people hear the word hospice, it can be very overwhelming and frightening. And so one of the things that is a part of my job is to kind of uncover what is hospice care and how does it apply to a loved one or that person in particular. The biggest difference between the two is you have to look at them as two separate services. So hospice care is regulated through Medicare. It is a service that someone can receive that has a life expectancy for 6 months or less. And so they've been diagnosed with a terminal illness, but that doesn't necessarily mean that that person will pass within 6 months. It just means that there is a culmination of issues or ailments to that person that would warrant them potentially passing within 6 months. Okay. So hospice, when something is appropriate, you can expect to have in-home nursing care with routine care visits. So through the company I work for, Transitions Hospice, we will send a nurse a few times a week to do a check-in for a routine care visit.
Okay.
And we take care of vitals, making sure that patient is comfortable, managing their medications, helping them with getting equipment and things like that set up. And it's all paid for underneath Medicare, Medicaid, and your private insurance. So the biggest difference between hospice and palliative care is that hospice is for end of life comfort care, where someone is no longer looking to seek aggressive treatment. They're no longer looking for a cure. They're looking to be kept comfortable and choose quality of life. Whereas opposed to palliative care is symptom management, and we're looking to try and get a more comprehensive and cohesive care plan in place.
Okay. So palliative care is it's longer definitely than 6 months, but say, is that something like maybe you have cancer and you're just trying to be needing extra additional help?
Yes, and by help, it includes a nurse practitioner. So our palliative program is overseen by nurse practitioners. We do have a medical director that also oversees the program. And Dr. Kapoor's job is to make sure that both hospice and palliative patients are getting the services that they need. But our palliative program is then carried out by nurse practitioners. So we provide a nurse practitioner to come once every 4 to 6 weeks or so. And they're trying to make sure that you're maintaining the goals that have been set in place for your care plan. So a lot of people that are on our services are suffering from or dealing with chronic illnesses that need symptom management. So she oversees that.
Now, with this type of service, that's, I mean, any type of palliative or hospice care, you guys typically across the board, across the United States would have the similar services, like you have a nurse or a doctor that would come in also to help weekly?
So the biggest difference is hospice, if we're looking at hospice first, it's regulated underneath Medicare. So there's certain criteria and guidelines that a patient would have to meet in order to qualify for that service. So if you're looking at transition specifically, the processes would be you would meet with me or an RHC, a regional hospice coordinator first. We would talk about, going over paperwork and then in helping you fill out that paperwork. And then we would request an order from your primary care physician.
Okay.
So your doctor has to write an order for the service. Once the clinical information and we've completed the consent signing, we would send a nurse to do an assessment to see if then that person qualifies for hospice care. Once they've been admitted to hospice, there would be a recertification period. So from the start of their hospice care date, 90 days from that, they would have a recertification assessment to see if we're still making progress and it's still appropriate. 90 days from that would be their second, and then it's every 60 days to make sure that the person still qualifies for hospice care.
Okay. Now what I was saying was it's pretty much about the same or similar across the board with all different types of
that depends. It's based by base.
Okay, because we have people like watching the show that are in Brooklyn, and then we have people in Savannah. So that's why I was like, is it the same with these services?
You're going to look at a hospice company and want to ask questions about what they provide as far as like our company is a family-owned company. We have some guidelines and philosophies that are specific to transitions. So we offer a service called a tuck-in, where when somebody is showing signs of declining in further into their hospice progression, we will send a nurse either in the morning or in the evening every day to make sure that they're okay. And then we also offer a vigil sitting. So when someone is more imminent, we will work with the family to make sure that they're never left alone. And that's a testament to our company. Not every hospice company provides that. Underneath Medicare guidelines, go ahead.
Is something like that when you say like a tuck-in services, is that something that happens typically near the end that they're daily? I mean, like I'm really not understanding how hospice completely works. I know it works in the last 6 months, typically in life. You said they come in 1 or 2 times, but when it comes closer to the end, are these services typically, like you said, are they daily? That's where the tuck-in comes in. They're there daily for the people?
Yes. So your routine care visits would be a few visits a week from a nurse, and the nurse is going to be looking for signs and symptoms of somebody showing a progression and declining and worsening in their situation. Once we see those indicators, we then start what's called the tuck-in service, where we send a nurse once a day to basically check on that person. Now, going back to if that's what you can expect from every company, that's more of a service that we provide. As far as end of life and quality and comfort care, most hospices, all hospices will be providing comfort focused treatment.
Comfort focused. Now, is hospice, is that typically like in nursing homes, or when it's hospice, you're at home, or does hospice services have their own facilities? I'm kind of confused on that too.
So that's a good question. So that's gonna change based off of your location. Here in Illinois, we're in the Champaign area. We also have offices in Peoria, Indiana, in the northern Upper Chicago area. We don't have a hospice house or a hospice location. We do all of our hospice care wherever the person resides, whether that be a memory care, skilled care facility, assisted living, independent living, or your home residence. But there are other states and other places where they have hospice houses and hospital wings that would accommodate hospice care.
Okay. The majority, I know people say when you go into hospice, I always thought it was like you're going into an actual building. But I know my father-in-law had actually, when they called it hospice, they brought him home and someone came to the house. Do some people or families have a preference that they prefer services at home for that closer connection in the last several days? Is that even optional? I know it was for my father-in-law, so I don't know.
Yeah, it's based off of the situation. So you'll have some people who prefer to, move to like a skilled care facility
Mhm.
and receive 24-hour nursing care in that environment as opposed to going home. It really just depends on the person's current situation. Finances obviously play a huge part in that. If somebody's paying privately to stay in a skilled care facility, that's going to be more expensive than staying at home. But then you're looking at hiring in caregivers if you don't have anybody to help. So there's just a lot of questions. We have social workers that work for transitions that can help people identify what would be the most reasonable and better outcome for everyone during those situations too.
Okay, now what's the difference? Suppose your loved one is already in a nursing care facility or one of the skilled care facilities where they already have nurses. Why would people still get either palliative care or hospice care if they're in a nursing or a live-in facility?
Well, if you think about it, you're living in a nursing home. Your nurse is only going to have so much time to devote to you specifically because they've usually got, 16, 20 other patients that they're also taking care of. When you're on hospice care, you're getting a nurse a few times a week. In addition to that, a CNA a few times a week. And we also have a chaplain and a social worker, and they're coming just specifically to see you. So they're spending that uninterrupted one-on-one time, making sure that you are comfortable. And if you're experiencing end of life care and services, that one-on-one time is really crucial because we're not just administering medication or helping somebody with pain, we're also helping with activities of daily living that would include an extra shower, helping with toenail trimming, nail trimmings, putting on your makeup, doing things that help you get more dignity in your life and more quality as opposed to shortened visits and not really getting the full quality of your life.
Right. Now, you had mentioned that Medicare pays for this. Is that something that's only typically for 65 and older? Because Medicare wouldn't be for someone with, say, unfortunately, cancer at 25. So would that then go with insurance or out of pocket?
So that would then go through your private insurance, or someone who has applied for Medicaid can also benefit from that. Medicare only pays, however, for hospice. Palliative care is billed out like a normal doctor's visit. So we would run your insurance just like you would if you were establishing a new provider or a specialty provider. And then it would be based off of your private insurance.
Is that probably because it's more long-term versus short-term? Or is that as end of life?
I'm not 100% sure on the regulations surrounding billing, but it's just billed differently.
Now, when it comes from if you need hospice and you're under Medicare, or you're not in Medicare, you're a younger person, is that medical insurance, or would that be like long-term care insurance people typically don't get, but is offered?
Well, your long-term care insurance wouldn't cover hospice care. That would be more so for like your assisted living expenses or memory care expenses. Your hospice benefit is going to be billed under Medicare Part A, and that's where the benefit is then covered.
Okay. Now, I thought that I love that you said even a chaplain comes into. I didn't know about all those extra services.
Yeah.
So a chaplain can come in and a social worker can come in also, besides the nurse and care. How has that been during the pandemic? Are they still able to service people during this time, or is that making things even more difficult?
Well, it's definitely making things more difficult, but we're still doing it. Zoom, like we're doing right now, even though it has its challenges, we are able to provide telehealth communication and visits for our palliative and our hospice care. Now with hospice, your nursing visits and CNA visits are still required to be in person. So you're not going to be getting your shower can't be given over a Zoom platform. But we can accommodate chaplain and social work visits through Zoom. We're also just doing extensive measures to make sure that PPE is worn. So if we know that the patient's been in contact with someone that's COVID positive, your nurse, your chaplain, your social worker is going to be coming dressed in full PPE, and it'll be a safe environment.
Oh, wow. Now, how do you even choose a company? What are the main factors you think are really important when you choose one? Because I know your company transitions hospices typically in Illinois and Indiana, a couple other states. But like I said, we have people in a whole bunch of different states. What are they looking for? What do you think are the keys?
Honestly, I think the key to choosing a provider, everybody has the opportunity as far as ethics goes to, shop around, ask as many questions as you can. I often tell people that are struggling between us and a competitor, ask as many questions to me and then go ask the same questions to that company, because it really is up to the patient and their family. We can't, sway a person to choose us just because I believe in the company's mission. When you're looking at getting a hospice provider on board, you want to ask things like, how many visits can I expect? What additional services are there for my family in regards to bereavement and counseling? Is there anything else that I can expect with social work if I needed help applying for Medicaid, or if we needed help with getting funeral arrangements and things like that in place? You want to you can go on Medicare.gov and look and see what the reviews are and see what other people who have used the services have said. I highly recommend reading reviews, because people are going to be very honest and open about how that experience affected them.
Okay. Yeah, that's great. Absolutely great. Now, you said bereavement too. So I guess even after someone passes away, is hospice care still there for at least a few days to help talk to people through those points? Or does it?
So for transitions, hospice, we actually follow a family 13 months after death of a patient. So we are there to help families go through the entire process for as long as it takes, honestly. We have social workers that are definitely trained and ready to help with those questions. And we're also just there for extended family members too. It doesn't just have to be the spouse of a patient or the parent of a patient or a child of a patient. It could be anybody that's affected by that.
Okay. Now, typically, one of the main I don't know if this is the main difference, but palliative care versus hospice. Hospice is making people comfortable near the end. So typically when you're hospice, they're not trying to revitalize people if they do pass. Do those things kind of come off the medical treatment?
For palliative care?
No, for hospice.
For hospice, yes. So you're looking at comfort care.
Okay.
What comfort care means is we're using things like medication to keep someone pain-free, oxygen, suctioning if needed, and then obviously nursing visits to make sure that we're not seeing any huge changes in the situation. Now we treat aggressively things like urinary tract infections. If someone was to get ill and it's not related to their hospice diagnosis, we would still treat those things aggressively. We're just not looking to cure the diagnosis in which they're on the hospice benefit for.
Okay. Yeah, that's why I always got confused. Like, if you're in hospice, do they just not care for something that pops up? Like you said, like a urinary tract infection, or I got a sore throat. Are they going to at least give me something for the sore throat? I was very confused on that.
Yes.
They still do. Okay. Great.
Yes. They still treat those things. Yes.
Now, do they have special activities for people in hospice? I mean, I know it depends on what level of functioning you have, but does hospice come in with activities for people to do, or to make the life a little more comfortable besides just laying there comforting is where I'm getting at? Are they social?
Yeah, so we have a form called Bringing You Joy, and we encourage all family members and the patient to fill it out, and it goes over their life history. So where they used to work, things that brought them happiness, favorite foods, things they like to watch, activities they like to participate in, clubs that they were members at. So we can try and incorporate those things in every visit that we're doing. When I first started working for the company, we had a patient who loved the Cardinals, and she had oxygen that she was utilizing 24 hours a day. And her biggest thing was she really wanted to go to the Cardinals game. So we sent her to the Cardinals game with a nurse. Being on hospice doesn't mean you have to give up everything that you love to be on hospice. It means that you're getting people to help you continue enjoying the things that you love up until the very end.
Okay, great. Personal question for you.
Yeah.
You're very young. What inspired you or motivated you to get into a field like this, where I would think young people are not looking at the end, but you're living with the end in the sense every day with your job? Why? How?
I love what I do. So I've been working in the senior living industry since I was 16. I started working at a assisted living and independent living facility, and I ended up staying there until I graduated from college. And then I worked for an assisted living and memory care facility locally. And then I was given the opportunity to work for Transitions Hospice, and it's in line with so many of the things that I love. I love my seniors. I've learned so much from them. I think that the younger generation really does have a better quality of life when they're surrounded by the elderly population. You learn things, don't have to go at such a fast pace. You have a better perspective on life. And I really just absolutely love what I do. It's very rewarding.
Oh, it sounds like it. It sounds like you even looks, it shows in your face how much you enjoy your position. That's good. I just wanted to know about that. I figured some audiences, some young people also watch our show too, obviously. But if people are inspiring to go into that field, it'll be nice for them to see what inspires someone else to go into that field and where they get enjoyment from. Now,
I think one of the things that's nice. Oh, go ahead.
No, go ahead.
I was going to say, I think one of the things that's nice is, when I go to bed at night, I know that what I'm doing is leaving an impact. So I think sometimes, at least, especially in 2020, we're all hoping that what we do is touching someone. And I know at the end of the day that what we're doing is making a difference. So it feels good.
All right. For you, you're a mom with 4 kids and balancing being this coordinator, a big position with other people's lives. Give us one tip before we go back into, we have a few more minutes, about just balancing that work-home environment, especially during the crisis of the pandemic. I'm assuming your company is probably overflowed with different requests needing care. So how is that extra stress with work and being a mom of 4 kids, a wife? How is that?
Honestly, I'm just very fortunate because the company I work for is very accommodating. They really do care about how their team is doing. I have a boss who's absolutely amazing. But you just have to be honest. You have to be honest about expectations, what's realistic, and you have to just be forthright with it. I think when we try to take on too much and we give ourselves too high of expectations, we can experience burnout. So we've just been able to have very open conversations, and our team is just really strong. So that's been really helpful.
Oh, okay, good. Well, a few more questions about palliative and hospice. Now, how is that? We talked about if you have to bring in your counselor or chaplain that they're in PPE. Are families still able to go in with their family? Like suppose if they are currently in like a nursing care facility, and with the COVID so high in a lot of these nursing care facilities, are they able to still visit with their families?
So that's going to be dependent upon the facility. So if they're a home patient, we abide by whatever the home is stating. So if they're letting family members come in, we are required to wear PPE. We are required to wear masks. We encourage family members when hospice is present that they're wearing masks as well. When it comes to someone living in a facility, that's going to be regulated based off of what that facility's guidelines are. So there are some buildings that are saying, yes, if you have, a family member that would like to visit a patient on hospice, that's fine. There's a limit to maybe 1 or 2. We have some facilities where, they've said, no, we're not allowing any visitors at this time. It's really just based off of the location of the patient.
Of the location. Now, with your hospice care, do you also deal with Alzheimer's patients too, or is that a separate function with both?
No, we deal with everyone. So we've got Alzheimer's patients, and I have to say that we have a family history in my family of Alzheimer's disease. So I definitely have a special place in my heart for people dealing with that. But we look at certain criteria when we're doing an assessment to see if someone qualifies. Alzheimer's disease is a qualifier for hospice. You just have to
Okay.
be in a certain stage of the disease progression.
Okay, because I know in my husband's family, his mom has Alzheimer's or dementia, and it's like trying to know, it's like, is this the end or it's not the end, because she's not even completely, shall I say, in our time, because of the Alzheimer's, she's not even making sense. So I didn't know, how do they even figure that out?
Well, always get an opinion from your hospice provider. So I always say, if you don't know, there's no harm in asking. So having the nurse come and do the assessment and letting you know if they qualify is the best way to start.
Okay, if they qualify or not.
Mm-hmm.
And you said approximately almost 90 days to about 90 days to figure it out if they qualify and reevaluation?
No, the qualifying takes about a day. I mean, we'll know if we've done all of the paperwork and then we're doing the assessment, you should, from start to finish, it shouldn't be longer than 24 hours. The recertification period, once someone has admitted to hospice, they would then have a recertification assessment 90 days from the first start of care. And that's just to make sure that they still meet criteria for Medicare's benefit.
Okay, so that 90 days they come back. And then I guess I only have a few more minutes. One major question that I have to ask, like when someone's in a nursing care facility, do you normally, if you are the guardian of that person, do you normally have to go with the facility that they're with, their choice of hospice, or can you shop around and look for yourself?
You have the choice of your hospice provider. It's patient choice, so you can use whatever hospice provider that you choose.
Okay, great. Well, thank you very much. I appreciate you coming on the show, Jessica.
You're welcome.
I know you really enjoy your job, and it's great to have people out there that really can help seniors, and just people in that last stage of dying is very important, and I'm happy you're out there helping.
You're welcome. Well, thanks for having me.
Thank you. So our day's topic was palliative care versus hospice. I hope you guys get some great information. We're going to have her website up there. If you need to go and look at anything, they have questions on their website, contact them for further information. Contact a facility closest to you if they're not there, to get the help that you need for your family. Hospice if they're in the last 6 months, and if they're in a facility, hopefully a nursing facility can gear you towards that understanding. Ask a ton of questions, okay? Please ask a lot of questions like Jessica said. It doesn't hurt to ask, and there's plenty of information out there. Be informed, and that's the whole purpose of Why and Why Not show, to help people reach their goals, get where they need to go, and be informed individuals, okay? Thank you again, Jessica. I hope everyone enjoyed the show. Watch us on YouTube, Facebook, and also on Comcast or cable TV. Thank you very much, and have a wonderful, blessed evening. Bye-bye.